Well, the new year has brought many new restrictions for many Canadians. The lightning-fast spread of Omicron is raising fears about hospital capacity, as we were just talking. Ontario imposed lockdown measures and moved schools online for at least the short foreseeable future. And in New Brunswick, students will learn from home until the week of January 24th, and that could be extended. Blaine Higgs is Premier of New Brunswick. He is in Fredericton. Premier, hello, and thanks for joining us today.
Good evening. You're very welcome.
So before we start talking about your province, I want to ask about your health. You tested positive for COVID-19 last week. How are you?
I did. Nothing like experiencing these things firsthand. Yeah, no, I'm recovering. It's been more like a bad cold for me. I've had my booster shot, and so it's been headaches, a bit of a fever, sore throat, but mostly congestion and aches. But I feel like I'm on the recovery, and it didn't really. I mean, I've been isolated, obviously, but it didn't really stop me from moving around. Let's put it that way.
Have you been able to determine how you came in contact with it?
Yeah, I think, basically we had gatherings with family over the Christmas break. And I don't want to pinpoint any particular family member, but I'm sure in some way it found its way here. And but it's going everywhere. And as your previous discussion, it is rapidly moving across the country in every province. And it doesn't seem, no matter what precautions you put in place and try to preempt this, it's here, it's going to spread, and we've resigned the fact that, yes, it is. And like everyone else, it's hospitals that are going to be the key area that we need to focus on and make sure we can adequately provide service.
Yeah, it's a tough reminder, isn't it? You think you're doing everything right, and it can still jump up and bite you.
And everyone that came here were all negative when they arrived. But
really interesting. Wow. Okay, well, I wish you well on that front. The province broadly, I think you've got about 500 healthcare workers isolating with COVID-19 right now. What does that mean for the capacity in New Brunswick to provide healthcare?
Well, obviously, we've had to restrict, elective surgeries and procedures. We've had to make changes across the network in that regard. We're also looking at, ways that we can, because much of it is related to contacts, not so much. So if people are asymptomatic and are able to come back and test regularly, we're hoping to track that very closely so we can get people back to work as soon as possible. It's a situation that's kind of day by day as we've seen. But at this point, we have roughly 50 in hospital and in the order of, let's say, 15 in the ICU to 20, and less than that on ventilation. So it is a milder form of what we've seen, but it's certainly rapidly expanding in every province, so we are going to see more cases.
Can you handle more cases? I mean, if there's a surge, there are surges everywhere. Just to, come the day, almost wherever you are, you can expect one, goes the thinking. Can New Brunswick handle a surge with all those healthcare workers isolating?
Well, it is certainly a challenge, and I commend all of the healthcare workers that have been the heroes through this whole thing for the last couple of years, in any sector of healthcare, cleaning services, hospital services, nurses, what have you. I think that for us, our highest we ever had in hospital during the pandemic was about 67. We feel that we can manage in the upwards in around 100. So that's small numbers in the case when you're talking like Ontario or Quebec. But it's still a stretch for us. But we aren't seeing the severity of cases. It's the same everywhere. That people are coming in and not necessarily going and needing ventilators as such, maybe needing aspiration of some sort, but nothing like we have seen in the past pandemics, past variants. So let's hope that continues and more people are able to do what I've done. I mean, I am fully vaccinated, but yes, it's been a few days where you didn't feel quite right, but it was like a bad congested cold for me.
Meanwhile, so you're going to remote learning in schools, but allowing, indoor dining and gyms can stay open in New Brunswick, I believe. What was the thinking there? Why go, sort of pretty far on one circumstance, but not so much on the others?
Well, it's been a balance from the very start between, kind of mental health and people's freedoms and people accepting that, yes, here we go again, and following rules of some sort. I mean, it's easy to for many people to criticize and say, well, lock this down and lock that down. But we found people are getting pretty tired of this pandemic, and we all are. But it's how much can we realistically expect people to do and follow the rules and do them in a diligent manner. And also being very cognizant of who's getting sick. So, if you have elderly people in your family and you just avoid it. I mean, we did not visit our our in-laws over this Christmas period. None of our family did because of the concerns. Everyone has to think about that and say, what are the conditions and who am I exposing? If not me, then who else am I at risk, creating a risk for? And what we're seeing in those areas that we've talked about, you just mentioned, we aren't seeing the spread there. We're seeing that the people that are going there aren't getting real sick. So we're trying to balance that aspect of living with COVID and managing COVID and not overrunning our hospitals in the process. So it is a balancing act.
I'm going to guess, restricting indoor dining and gyms remains a tool in the toolbox that if you need to go that route?
Yes, it does. And so we're trying to, as I say, we're trying to find a good mix here. And we feel that that'll be, it's going to spread. We feel that we're not going to be able to stop this. And so if we can just have people follow the rules as much as they can and be consistent when going to dining rooms, when going shopping, just following the basic health rules we've been following for 2 years, that we can have a better outcome than just trying to cause people just to be totally isolated and not doing what any aspect, because we think frustration sets in and then people just get, I'm tired of this. Your province has also scaled back PCR testing to those in the general population, right? If you aren't a member of a high-risk demographic, you're now asked to use a rapid test, but those have been in short supply in New Brunswick. Are you worried that your province could be flying blind on this, We have lots of rapid test kits, but I think the reality is none of us can accurately predict the number of cases that are out there right now. And it's even more difficult going forward. You can't begin to contact trace the cases. It's just physically impossible to do it. So, we all want to know how many are there, but I don't think any of us really know. And it's only going to get worse. So we got to have everyone individually taking responsibility. That was kind of the point of this, is saying, you've each got to do your part, because we can't trace all your friends and family and everyone you've had contact with, because the cases are expanding so rapidly. And every province is in that very same situation. All right, Premier. Well, thank you for your time. I wish your province well, and I wish you well in your recovery. Thank you. Thank you, Paul. Appreciate it. That's Premier Blaine Higgs of New Brunswick.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.